Assalamu alaikum wa rahmatullahi wa barakatuh. This is Abdulaziz Batawi, student from the EE 471 class, and today I'll be presenting my project about the biomedical instrumentation. So each student were chosen based on their performances with a specific instrument that is mainly in a hospital. So today's topic, we're going to talk about the complete blood count hematology devices. These devices are mainly found in laboratory. As we know, the core of any hospital, or one of the main part of every hospital, is the lab, where they need to do, after they do visual diagnostic and having a conversation with the patient to know the history, usually they do the blood testing. So one of the main major diagnostics or important even for ER patients is the blood test, and especially the complete blood count known as the CBC. So in the CBC, usually we know what kind of how many red cells and blood cells, so we know what is the component within the blood itself. Here are like type of devices that we could usually see in a regular laboratory. So after they take the blood sample from the patient, usually they go run through these devices. So what's good about these devices is that they run the test of multiple bodies in the blood to diagnose them or to know how much it takes 30 seconds to 1 minute to give the results. So how does it do that? So it's something similar in the microfluidics, when you do the blood testing at home. But here it depends on the culture counter or the impedance counter, where basically there is two electrodes and there is a narrow passage that it goes through it, the particles themselves, for each defined body as it's known, and there is like the sensing area. So here they need to add a conducting liquid in order for the electrodes to tell the difference between the changes. So these changes will be based on the size of the particles themselves and the speed they flow through it, because they will go under the same setting, but they will differ in the amplitude given and the period for each body. And then we have a different methodology, which is the flow cytometry. As we can see, this video represents the idea of how can it tell the difference between the body. As you see, this is a small body going, this is a basophil body going, and yeah, so these are the types of the blood count that it includes in the CBC test. And here it uses a laser and a receptor or a mirror for the digital reflection of the body itself, instead of doing it through impedance. And finally, after running a blood test, this is what we see in a regular screen of a device. So mainly we see the WBC or white blood cells count, and we see the RBCs, also known as the red blood cells count, for the whole body. And then we have the HGB, which are the hemoglobin level. And then we have the differential parts from the WBCs, also known as the neutrophil, lymphocyte, monocyte, eosinophil percent, and basophil. Us as an engineer, we need to understand that these parameters are important to the doctor so they can distinguish the situation or what they should and how they should treat the patient themselves. Mainly, the issue seen for these kind of devices is blood clotting as resulted from misuses or hardware failure, and usually for this it is must be cleaned. But as we've seen in the first slide, that these devices are kind of complicated and compressed as they are small. So the only way is to deal with this kind of issue is using the Clorox solution, which is kind of tiring for engineers. Hope you enjoyed the presentation. Thank you for listening.